Sir, I have a question regarding women, cancer in women especially. Uh, as I've read that breast cancer is like the most common form of cancer. What do one should do to early detect something like that? Yeah.
So before we go to breast cancer, cancer in general, if you look at cancer in India, commonest cause of cancer in India is tobacco. In our area, areca nut, supari, alcohol. Some of our dietary practices and preferences, how much of fat, how much of red meat, how do we prepare the food, and then exercise, how physically active we are, and then some infections and inflammations. If you take care of these five, all of these are lifestyle issues. We would have gotten rid of 40, 50, 60, 70% of cancers in this country. A large proportion of cancers can be prevented. Take away cancers for a minute. Heart attack causes are tobacco, alcohol, diet, exercise. Stroke, tobacco, alcohol, diet, exercise. Diabetes, tobacco, alcohol, diet. Hypertension, tobacco, alcohol, diet, exercise. So many, retinopathy, so many infertility. So these four causes account for a large number of diseases in community. And for every cancer that we see, there are probably 20 other non-communicable diseases, all caused by the same set of etiological factors. So when we're talking of cancer prevention, we're actually talking of health promotion in the community. You not only prevent cancer, you also prevent heart attack, stroke, so many things. And that is a very important, that does not need a doctor or a hospital to champion. You and I, anybody here can be a champion for healthy lifestyles. And that is, I think, ultimately it's only a healthy population that can be productive. It's only a healthy population that can protect itself. And so as a nation, promoting health is a national responsibility. Breast cancer, so common cancers in women are cervical cancer, which is gradually going down without any screening in place, without any vaccination in place. Cervical cancer is gradually declining, and breast cancer is gradually increasing. Cervical cancer is caused by a virus called human papilloma virus. Now we have a vaccine also against it. But this is a disease of the lower strata of society. As our lifestyles improve, as the socio-economic parameters change, as more affluence comes in, people have more access to healthcare. They have more access to prevent. And so cervical cancer is going down just by improving lifestyles. It is not that breast cancer does not occur in poor people, but it is more common amongst because of diet, because of exercise. See, breast cancer occurs because of a hormone called estrogen. It's a female hormone which causes the breast to proliferate. And estrogen secretion, production happens from the time that girl starts menstruating to the time she stops menstruating. So what happened was in earlier years, kids used to start menstruating around 13, 14 years, 15 years. As our lifestyle changes, as our dietary pattern, as we are consuming more fast food, more junk food, more fat, more, and our lifestyles become more sedentary. Kids don't even have to get up to switch on uh, they can use a remote to switch on they can call Alexa and ask the television to. And so as we become more sedentary, menstrual patterns are changing. Kids now start menstruating when they are 8 years, 9 years of age. And so the period, and they stop menstruation when they are 45, 50. So the period of estrogen stimulation has risen. And so because of affluence, the risk of breast cancer increases. Along with breast cancer, cancers of the uterus, endometrium, cancers of the ovary, cancer of the colon, all of them rise as a result of shared etiological factors. Some there are other, oral contraceptive, other parameters, some radiation, all that is there. But in general, a healthy lifestyle will go well. So exercising is so important for women at all ages. Kids in the first 10 years of life, gymnasts, people who are physically active, will start menstruating much later when they are 14. If you look at a Nadia Comaneci, menstrual periods start much later. So it is very important for us to encourage our girl children to be physically active, skipping, cycling, swimming, running,
Right from the childhood.
right from childhood. In adolescence, in the teenagers, young adults, older women, 50, 60, 70, it is important to be physically active. It will prevent osteoporosis, it will prevent many things. It will keep heart disease away, it will keep cancers away, it will do good. For men also, all ages, physical activity is very important.